Hi, everyone, and welcome to the latest webinar co-sponsored by Coronis Health and Hired Power. This webinar is called Two Critical Resources Your Behavioral Health Facility Should Be Leveraging. And so whether you are just starting off or you're an existing facility, it is absolutely imperative to leverage outside resources to ensure your business stays ahead and stays profitable. But behavioral health, as we all know, is a highly unique specialty, and it requires very specialized services to match. And finding those right resources takes time. So to help bridge the gap, we have brought together two trusted strategic advisors. Both of them offer auxiliary resources, technology, and expertise only and exclusively to behavioral health facilities and in the behavioral health space. So without further ado, meet our speakers. Our first speaker is Marnie Luther. She is intake director at Hired Power, where she is the first point of contact for potential clients and families. She has over 30 years of experience in the behavioral health and addiction field, and she brings a very high level of expertise, understanding, and compassion that allows families to trust and engage with the services being recommended. She began her work as an local inpatient psychiatric and addiction treatment hospital, and has worked at many of the nation's top treatment programs, and also has worked on the medical software side. So very excited to hear from Marnie. Then we also have Tracy, who is division president of the behavioral health division of Coronis Health, which is a large revenue cycle management company. Her company supports 75 customers in almost every state in the country, all treating substance use and mental health patients of all ages and levels of care. Tracy has 30 years of experience managing teams and Fortune 700 companies, all the way down to privately held organizations. And she has a lot of experience working with diverse groups, even across in Europe. So without further ado, I will hand the microphone over to Marnie and Tracy to get us started. And they are going to be speaking about today our agenda. We have a packed agenda, but basically we're going to start with the top 10 billing challenges, go into the art of admissions, how to handle a safe and structured transition to and from your facility, and then continuing care after they leave your facility. So Tracy, all yours.
Thank you, Risa. Thank you, everybody, for joining. I do think we have a couple poll questions that we can throw out to the group to get an understanding of the audience today. And the first challenge that treatment facilities face is probably my number one. It's number one on my list, and that's why I wanted to start with it. And it's
absolutely great. Thank you for the reminder. So do you guys see the poll up on the screen? All right. How long has your treatment center been in business? Are you a startup just getting into this, less than a year, 1 to 5 years, 6 to 10 years, or 10 plus years? This is anonymous, so you can be honest. And then second, what is your payer mix? And you can check all that apply here. So are you all private pay? Are you commercial insurance? Are you Medicare, Medicaid? What is your mix? And if you can check all that apply, I'll give you guys all. I see a lot of you are not responding here. Let's respond to these questions so that Marnie and Tracy can best direct their education. So, okay, 5 seconds. All right, here we go. So let me share these results.
Oh, wow, what a mixture. Okay.
Yeah, so I think, you know, we have a very big range of how long you've all have been in business, from just getting started to 10 plus years. And then for the payer mix, most of you accept private pay and commercial insurance, and a few of you, 27%, are some sort of government insurance.
All right.
So thank you so much for responding to those questions. And now, Tracy, take it away.
So this topic affects all of you, whether your payer mix is commercial insurance or government, whether you're just getting started or you're an existing business. Credentialing, it's like this stepchild that no one pays attention to, but the importance of it is mighty. It's the process of getting the facility listed with a profile with all the different insurance companies. And at first, first, you're provided what's called an out-of-network status. And until you have that, you can't get paid. Claims can't get adjudicated, they don't recognize you, they don't know who you are. And what is entailed in that process is sending off your licensure, your NPI number, certificate of insurance, a W-9, EIN letter that you get from the government, and some other paperwork in order to get that set up. Really critical in the beginning stages of setting up a facility. And if I were to start working with an existing facility, it's the first thing we check to see if there's any mistakes. And a mistake can be something as simple as the suite number was left off of the address loaded with the payer, and it doesn't match your EIN letter or your W-9 or the information that you have in your NEPIS account. Now, while some commercial insurance payers require the license, not all require it to set up a profile. So that process can get started fairly early. When you do get a state license, if it's required, that can be submitted along. And it's also really important to keep NEPIS up to date. Whether you add an address, you add a level of care, so therefore that would affect the taxonomy that you're servicing. And finally, once you're accredited, you can then be considered with an in-network status. That usually requires Joint Commission or CARF, and that is a process we can help you get involved in if you wanted to look at in-network credentialing.
Hold on, Tracy, really quick.
Yeah, go ahead.
The slide is not letting me move. Give me a second. I thought we played with
Press
that.
escape. Oh, there you go.
Hold on. So sorry. Okay. I apologize.
That's all right. Thanks, Marnie. And my second point is to hire right. I can't tell you how many facilities come to us with the OBGYN doctor as their primary physician when they're going to render inpatient level of care, so detox and residential. And while they're still a doctor, they ideally should have an accreditation with an addiction medicine specialization. We've seen too often where an OBGYN doctor, for example, their taxonomy is rejected because it's the wrong scope of provider. And I've seen this in government as well as in commercial. Really, you should look for an MD or a DO, which is osteopathic medicine. The other important roles in hiring, right, are your admissions and your intake folks. These are the critical first line defense team, so to speak. They're the folks who are talking to patients. They need to understand verification of benefits and insurance policies. They're probably really critical in making the decision of admissions and the patients that you take. And that's not only from a perspective of understanding insurance, but is this the patient right for your program? And that's where I want to segue to Marnie, because understanding if that patient is right for your program is a critical part to the success of the patient.
Thank you, Tracy. Yeah, admissions. So let's talk a little bit about admissions. I'm sure a lot of you on this call are from facilities, as we saw, or programs, different types of programs, if that's a beginning treatment program or primary treatment program, a detox, a transitional living, or a sober living. Admissions is one of our most important positions, like you said, Tracy. We want to make sure that we are, as an admission person, I've been doing intake, let me back this up. I've been doing intake for years, and I think one of the most important things in admissions is making sure that you have somebody who's going to answer the phone when a call is being given or coming in. Now, I know we all know that we're busy and we can be on other calls, but getting back to that person is crucial in a timely manner. And then once we've got that caller on the phone, we want to make sure that we are helping them, join them in their conversation. What are they talking about? What do they need to do? What are they looking for? Those questions, back to what Tracy was saying, making sure that we are doing an assessment that that client is correct for our facility And or if not, what are those referral sources we're going to refer out to? Does your admission team have referrals to give to if they're not appropriate for your facility? For example, if they're not appropriate for your facility, where would you give them to? Do you give them 1, 2, or 3 referrals? Maybe they need a different level of care. Maybe you're detox and res and they've been through treatment several times and may need that next step. So I think as an admission team, it's really important that they have or develop a list of different services. At Hired Power, we provide interventions. Do you and or your facility have a list of interventionists to help you guide those clients into your treatment facility if they are appropriate for you? Or if they're not appropriate for you but still need an intervention, do you have that list? Have you developed a list of safe passage or transporters to help you get that client into your facility? So all of making sure that you guys have, as an admission team, the information that you need to help these clients out. Again, with Tracy, do you have a client there that, or have a admission person there, sorry, I'm getting confused, have an admission person there that knows about the VOB and who and how you get that to the person that's going to run that VOB for you. So the planning for your admissions is really an integral part of any facility, is planning to make sure that you are having the right services within your facility to meet the client. If not, where are you referring them to? And then the right services for the whole continuum of care. An interventionist, a safe passage, other services that you can refer to. Joining the caller. We need to listen and reassure that we're hearing them and that we can help them and supporting them through what it is they're looking for. Remember, each person that's going to call you is going to call for a different service. It could be somebody that just needs to go to detox, and maybe after detox, they can't do that residential program, or they need to go home and be with their family. So what are those services once they're in your facility you can help them with? And what are you going to do on the front end to make them feel comfortable that you're that right person? We want to make sure that we're supporting them and their family. And caller burnout. I think it's really important that we remember a lot of families that are calling us, this may not be their first time. And if it's not their first time, how can we help them? We want to be supportive to, again, getting their client or their loved one into treatment. If that's via an intervention, a safe passage to your treatment center, maybe the family needs education. At Hired Power, another service we offer is called EPIC, and it's a program for families where we educate, integrate, educate, plan, integrate, and coach the family through the crisis. We want to make sure that once we get that the family's healthy. Family systems are really important. Clients aren't going to get healthy if the family's not healthy. But maybe once we get the client into treatment, we help the family through that admission process. We get them through treatment. We want to focus on the family and help them. Maybe mom needs Al-Anon. Maybe dad needs treatment. Maybe there's other siblings that have issues going on that we can help them with. So really, family system and helping them. We also offer case management, which is another component of working with a family. When a client is in treatment, once we get them to that door to you, case management, not only for the client once they get out of treatment, but for the family when they're in treatment. How about how is that family going to set boundaries with that client? How is that family going to heal themselves through the trauma that maybe the whole family's been through and in for a really long time? And case management has a person that's going to work with that family one-on-one and help them understand what's going on and how they can make things different on the way out. Back to you, Tracy.
Thanks, Marnie. My third point is to get accredited. And we don't care which one it is, just pick one. But I would like to see all facilities get either Joint Commission or CARF. It just raises the bar. And the insurance companies look at this. They look to see if you have an accredited facility, it provides accountability, it lessens risk. I know these are tough to go through. We can recommend some consultants who are very good at helping you get through this process. It's an important next step in your business to get either Joint Commission or CARF. My fourth point is to embrace the ASAM level of care. And what we're seeing more and more from the payers is that they are following ASAM criteria and the guidelines for either placement, continued stay, transfer, as well as documentation. And this quote I have here is word for word from a letter from Optum that many of my facilities have been getting lately, particularly in California. And it's, I'm just going to read it. It's Optum's expectation that the level of care being requested matches the service rendered in accordance with ASAM. It is recommended that you review ASAM criteria to enhance your understanding of expectations. They want you to follow ASAM, and Optum is sort of the top of the tier here. Everyone seems to be following their lead, and everyone is going to follow suit. So it's a good idea to read up on ASAM and become familiar with how to document to ASAM along with placement guidelines. And this segues into my point about documentation. Care managers are forever challenging our utilization review team on what triggered this admission today. Why today are they seeking treatment? What was different from yesterday? The payers, they see that the patient's been in treatment several times. They have the history, they know. So what was it that made it different this time? So it's so critical to ask very probing questions to help. The writer needs to do a great job at documenting the contributing factors of the treatment and what's going on with the patient so that my utilization review team can do a better job at advocating. A good writer paints a vivid picture of why the client is seeking treatment. Try to provide direct quotes. Give examples of the severity of, the client's abuse. Details that prevented episodes of treatment. In recent events that led up to the client's admission. The why now question. A lot of times these reviews have to be faxed in or done online. It's not always a phone call where we can have a relationship with the care manager, the case manager to advocate. If it's not in writing, it didn't happen. Good point to make on documentation. I see this a lot in California, and so it's what's prompted me to bring it up. We hear a lot, especially in outpatient, where, hey, the state of California doesn't require me to get a state license. I don't have to, do anything there. Yeah, that may be true, but the payers require some kind of certification. And so in order to get paid by an Anthem or Blue Cross, Blue Shield in California, we need to see some kind of outpatient certification. They want to see a special mental health license, which is offered by DHCS. In Florida, there's an ACA license for mental health that you can get. You need to have a CLIA waiver if you're going to do point of care testing. Medicare, they require certification from the Substance Abuse Mental Health Services Administration, or SAMHSA. So there's a lot of accreditation that is required with the payers, and it's not necessarily a state guideline to follow, just something to keep in mind. And my point number 7 is to understand verification of benefits. There's so many different payers. There's so many different self-funded, fully funded plans. How much is a person's deductible? Who's going to get the check? You know, for those of us in this industry who are seasoned, you know that Blue Cross, when you're out of network, the patient is going to get paid. It's a crazy policy. Understand, you know, we pride ourselves in trying to be very thorough in that verification of benefits stage, calling in the benefits, trying to be as detailed as possible, whether that be down to specific codes that will be covered. And this is all critical information that we provide our facilities, as well as train them on how to read the verification of benefits or read that card. So we think it's another important piece to pay attention to. Marnie, I think that might segue to you. Oh no, one more.
One more.
Okay. Finally, I am a big fan of being a student of the data. You know, having worked with over 70 clients now in many different states, I clearly have a lot of data. I had a call yesterday with a facility who's looking at expanding into different states. They're based in California now. You know, what does it look like in North Carolina right now, or Georgia, or Tennessee? And we have that kind of information on average reimbursements. We are happy to share that with our clients or prospects. And even just running your business, you know, the kind of reporting, the level of detail we provide our customers on a day-to-day basis, weekly, monthly, very, very detailed. We want you to make smarter decisions, so we enable you with the data that we provide. Oh, I got one more. Okay. One of my final points is to, you know, buy the best EMR you can afford. And I will say I happen to be a fan of Kipu. I'm able to pull a census from Kipu. Aliva, I'm able to pull a census. The others, I can't do that. A little more challenging. But regardless of who you choose, you know, choose someone. I can't work with anybody who's putting notes in paper. Choose an EMR that you can afford, and you know, I'm agnostic to the EMR. I really don't care. You know, pick one. It's always important to get the best you can buy.
And I'm going to back you up on that. I spent 9 years selling electronic health records, and I think just as a business, as a facility, it's so helpful. And then again, for your RCM company like Tracy, it's nothing like it. Paper is so difficult. So EMRs are very important.
Yeah.
And then you said that.
Yeah, finally, you know, really look to partner with a company that can grow with you. You know, we've got over 100 staff, a lot of depth on the bench. You know, I look at those who may have an in-house team, and you know, what do you do when your UR person is on vacation, you know, or sick? Who's going to call in the cases? I think also an in-house team can become very insular. And, you know, a revenue cycle partner, it's a skin in the game model. And, you know, I don't get paid until you get paid. And I have every incentive to try to appeal denials, work every claim as best I can to get paid. Otherwise, I've gotten off, I've done the billing, and you know, for nothing. So we really are very incentivized to get you as much money as possible.
Okay, back to me. So all of you guys know that I can talk about this for days, so I'm going to try to make it, you know, just to the point. I'm really passionate about families and doing the services that we do. But what's the importance of involving a family? The importance of involving a family is for the exact reason of a client. As we all know, if a family's healthy, a client has a better chance of getting healthy and staying healthy. So what are those resources? Again, back to your admission team or your clinical team during the process of somebody in treatment, what are those resources that they are giving the family while their loved ones are in treatment? Is that a Betty Ford family treatment? Is that Epic from Hired Power? What is that service? I really think, again, having a family get well alongside a client is going to make it better for everybody. And why it's not only about the client. Again, you know, a couple slides back, we talked about burnout and the families, you know, going through years of trying to get their loved one healthy. And once they, you know, once they think that their loved one's in treatment, everyone's going to get better and everything's going to be healthy. Well, that's not reality. Reality is that client may be gone in treatment and doing what they need to be doing, but what are we doing to help the family? Again, what are those services? At Hired Power, we provide EPIC, which is the family program that we have to educate, help them plan, integrate them into those community resources, and coach them through that. Also, case management. Case management is really important. Help that family to prepare for that loved one, either coming home or looking at what those next steps may be. So it's not always about just the client. We want to develop a safe and structured transition plan to get the client from one location to the other. So what are we talking about? We're talking about safe passage. I love this topic and I could go on and on, but I'm going to keep it short and sweet. So safe passage is getting somebody from treatment, from home, hospital, detox, jail, to the next level of care. I'm not sure if any of you guys have seen this. This was years back when a client actually died in the custody of police in Arizona, trying to make it on her way to treatment. So by hiring somebody to help get your loved one to treatment, you have a better way, you know, stay away from what's happening right here and getting them to that treatment center safely. Transitions. So on admissions, when you're taking a call and the family is saying to you, I don't know if we can get them there, they have a dog, they need to get in the kennel, or they can't make it through the airport, they stop at the bars. We've had many incidents like that. We have what we call a personal recovery assistant who is doing the safe passage, who can fly to that person's home, drive to that person's home, hospital, again, jail, wherever they may be, and help get them to treatment safely. Make sure that that dog is in the kennel, help them pack. And maybe just walking through that airport and getting by that bar is really important. We've had many people who have made it to the airport and never could get on the plane because either they've stopped in the airport bar and got too drunk, or they stopped at the airport bar, got drunk and decided it wasn't for them. So having a staff there with them to help get them to the treatment facility, you have a better chance of actually having an admission. I know we all, you know, well, why can't we do family? Why can't a family member do that? Or why can't I just have a facility, you know, somebody from my facility come and get them and transition them there? Well, there's reasons why we do that. We at Hired Power, we are gender specific. So it will always be a male with a male, female with a female, unless clinically indicated that would be, that would need to be different. We're certified. We know what to do when we need to do it. We are no hands-on. So zip tying and doing that kind of behavior is not something we condone or do. And we can do it anywhere from an adolescent all the way through an older adult. So we can go more into that. Transitioning through the recovery process, safe passage between level of care. Again, always getting somebody to treatment. If you have somebody in your treatment center or coming to your treatment center that says, I can't come to treatment in 5 weeks, I have a wedding and I have to make that wedding. One thing you can do on the front end as an admission coordinator or intake person is say, come to treatment, let's get you in here. And if you need to go to that wedding in 5 weeks, we can have a personal recovery assistant do a safe passage with you to get you to that event and get you back to treatment safely. Or if they have a court appearance, they can't quite make it because I have a court appearance in 3 weeks and I can't miss it. Again, get them in that door of treatment. And if you can't get that court appearance rescheduled, again, we can have a PRA come pick them up, take them to that court appearance and get them back to treatment. So really having the knowledge and knowing what your resources are as an admission person or even in treatment, what needs to be done for that client while they're with you, we can transition them through levels of care. At the end, when they get home, when they're ready to go home, maybe if they couldn't get through that airport on the way there because of the bar, imagine trying to get back, through that airport on the way home. Just because you did 30 days of treatment doesn't mean that craving's not there and it's going to be hard for you to get through it. So let's make sure we get them to that next level of care safely. On here, we have personal recovery assistance. I want to talk a little bit about a personal recovery assistant. Personal recovery assistants, AKA what others call sober companions. We call personal recovery assistants because we don't only do addiction, we do mental health and eating disorders. And having a personal recovery assistant or sober companion is somebody who can help you transition again through services. Maybe once you get home, you need a personal recovery assistant to help support, guide, and mentor you at home. Get through those couple days of finding that community at home, finding that 12 steps, smart recovery, refuge, celebrate recovery, the meeting that you need, finding a sponsor, cleaning out your house if somebody didn't do that. If you had an intervention and somebody, they took you from your home, but there's still alcohol and other things in there that you need cleaned out. Somebody as a personal recovery assistant can come in and help you with that. Their real goal and as a personal recovery assistant is to guide, mentor, and support you in life in recovery. Which of these transitions should the admission team be concerned with and why? I'm going to be honest with you. I think all of them. I think as an admission team, you want to know who your interventionists are and where they're located and how they can help your client. You want to know what your safe passage team is and where what level of service you can use them on. We all know identifying factors for the clients at high risk that may need those other services. People with a readmission history, if they haven't been able to get to treatment or they get there and they relapse on their way home, maybe they need a safe passage on the way home. Comorbidities, two different, other things going on. Do they need somebody, maybe it's not the substance abuse at this time, but it's the mental health and the anxiety of getting them there. Making sure that everything is in line with them when they get home. If they have numerous care providers, case management is a perfect example of helping coordinate all those care providers together and helping the family and client know that they can go home and have somebody help them, pull everybody together, help them with their medications and help them with their providers and make it a team. Psychological and emotional factors, again, if that mental health is there, helps. PRA is going to be there to help support them. A case manager, maybe for family and or the client, is going to help them with their appointments and relationships and family matters, just somebody there to support, guide, and mentor them. And then having, it's like having a friend, but somebody who's there to be a little more than a friend and guide you. And other levels of service, you guys, are these clients, when they leave, are you going to send them to another level? Are they going to sober living? Do they need a transitional living? Maybe monitoring is what this client needs to stay sober. So looking into monitoring programs. Continuum of care is really, really an important aspect of the whole treatment, and knowing on the front end when your clients are coming in through admission, we're the first line of service of what the family is telling us and what this family needs. So as an admission coordinator, making those notes for your continuum care so they know during the process when they're in treatment what that next service looks like is really, really important. It's a key factor, I believe, for recovery and for the individual as well as the family. And I think I kind of just went over that, but I want you guys to look, and I don't want to keep skipping over, but it's important that, you know, we all know what the next level is for our clients. I'm letting you guys read this because I went over it quickly. And then responsibilities. I want to talk a little bit about the responsibilities for everybody in the family. So once the client gets home, I think case management is a good component of this, is helping develop a relapse prevention plan for everybody, not just the client, for the family. What is the family going to do if a client relapses? What healthy activities can you do, can the client do and or the family member do? Yoga, meditation, art, writing, finding new passions. Healthy sleep patterns is very important, and habits. And then awareness of the client's stress level and triggers and or the family. We want to make sure we're not triggering each other and making them go back to those, you know, when they have triggers, what is that coping mechanism they used before? Was that using or drinking, and helping them identify those triggers and realizing, you know, if you do have this trigger, what can we do besides use a substance? We can do yoga, we can go for a walk. Really, really important. And then accountability. Back to monitoring. Monitoring is a daily accountability program, lowest level of care, but allows the family and the client have their own accountability. For example, I'm going to give you guys an example of a monitoring client. We get a lot. We had a client for about 4 years. He came to us out of treatment. He was a motivational speaker, very successful, but could not stay sober on the road. And one of the big things in his marriage and with his kids was him being able to be accountable, not only for himself, but to his wife and family, that when he travels, he's going to be okay. He started the monitoring program, and honestly, you guys, was with us for 4 years because it allowed him to go do his work, not have an excuse, but know he's accountable to not only himself, but his loved ones, to stay sober, to stay on task. And it made him more successful, better at doing what he was doing, and then being able to come home and have a happy wife and happy children, and them knowing that he was doing what he's supposed to be doing. I always tell families, it takes the monkey off their back. Like I always tell the clients, not the family. Let me back that up. I always say to the client, nobody's going to be watching over you if you're doing what you're supposed to be doing, and your tests are coming out right, and you're checking in every day. You're good. So monitoring is a really good plan for personal accountability. And then in review, patient and family engagement. Again, making sure the patients and the families we're meeting the needs of the patients and the families. It's not only the clients that need help out there. So let's help the whole family system. Identify, I have to move this, give me a second. Identify, patients that are at risk. What services can they use or do they need besides just treatment? Maybe when they're in treatment, until they get settled, they could use a personal recovery assistant. Not only picking them up, and we do this often, is we'll do a safe passage, we'll pick up a client, we'll get them to treatment, we'll stay in treatment with them as a one-to-one for a couple of days to help them get situated and comfortable and help the facility get comfortable with that client as well. Multidisciplinary collaboration, and that's what I mean. Let's all work together. We all know, if we work as a team, everybody's going to get healthier and better. Planning the transition from the very beginning, again, is one of the most important things we can do, starting on our admissions. And then your leadership support. Make sure your leadership and your teams are all on the same page about what that may look like. And then continuing care and relapse prevention we went over. So I think that's it for me. Risa?
Great. Thank you so much. That was great. We now have time for some questions and answers, and I have a couple already coming in. So at this time, anyone that has a question for Marnie about any of those transitional services, or for Tracy, anything on the finance or revenue cycle management side, this is your opportunity. So here's a question. Why can't I have a staff member or a family member do the safe passage?
Good question. So having a professional help you with that transition, staff members, I mean, the difference is family members are always going to push, they're going to be able to push our buttons, and staff members aren't trained. All of our staff go through a certification, IRI or CCAR. IRI is the International Recovery Institute. I'm so sorry.
That's okay.
And CCAR is a international or a national training as well. You want to make sure that they're trained in what's going on with the client, mental health, substance abuse, and getting them there safely. Like I said, families, once you get a family on board trying to do that, I'm a mom. I know my family or my kid could manipulate me to maybe be like, maybe this isn't the right, maybe you can come home because that's what you want as a mom. But having a professional, they've been there, they understand, and they're going to help support them through the transition.
Got it. Interesting. Okay, here's a question for you, Tracy. So I have an in-house billing team that's worked well for the last 10 years. How can I afford to outsource?
Thanks, Risa. My answer to that is the in-house team, I think I mentioned it earlier, can become very insular. There's no incentive for them to get the claims out on time, collect the claims timely, because they're going to get paid regardless. Whereas an outsourced third-party biller, I don't get paid until you get paid. So I'm getting the claims out weekly. I'm trying to clean up any issues that may be lingering to make sure all the billing goes out. And then, of course, adjudicate as many claims as possible and collect as much money. I have stories where just recently, large in-house team based in Arizona had a huge team of 10 people and took the leap of faith, outsourced with us a year ago, and their collections increased 15%. They're my top referral right now. Very happy. There's a lot of circumstances that, or a lot of, services and incentives we have as a company to get the job done timely in order for them to get paid. And, it wasn't any more money than what they've been paying the staff internally. So it was a win-win.
Wow. Okay, well, this is a good follow-up question. What if I value a personal relationship with my biller? I guess like someone would get if they're sitting in this office next to them.
Yeah, I get that. And what we do is assign each facility, they're assigned a utilization review rep if that's a needed service. They're assigned an account manager. They have a team that becomes familiar with their account, and they're the one-stop shopping. So it is like having somebody down the hall. And I guess in this virtual environment, I guess that really isn't relevant anymore with this virtual world we have now. They're all just a phone call away. And what we do try to do is think of, or in assigning an account manager, is assign someone who's familiar with the state of Georgia, where the facility is located. So there's an instant, I know that Molina Healthcare in whatever state is quite a pain in the booty, and we know how to get around that. And so they have a familiarity.
Got it.
Yeah.
Okay, here's a question for you, Marnie. Does Hired Power have people across the nation who can help with safe passage, intervention, or case management, or is it regional?
We do. So Hired Power, being based in California, all of our staff are now employees, but we do have staff across the country. We have a roster where we pick and try to match not only the personality of the person, of course, we're gender specific unless clinically indicated, but also the region that they're in. Our goal isn't to fly somebody from California to New York to pick somebody up. We want to find somebody on the East Coast that's a little bit closer. So the answer is yes, we do. And again, the difference between us and a lot of other facilities or companies like us is that our people are employees. So we do carry workman's comp and the insurances and liabilities needed with employees.
Okay. And I guess a follow-up question to that is it advisable to have a PRA or someone from your team to do a safe passage to accompany a family member on a safe passage, to have both?
Yeah, you know what, we have done that before, and that really is something that we would want to discuss with the family and the treatment center that they're going to. But yes, we are able to do that. And on some occasions it's appropriate, some it's not. And so we're open for conversation.
Got it. So for a safe passage, who organizes all the logistics?
So we do, actually. We have somebody named Tracy Waters who organizes and handles all of our safe passages. So when a family calls, once the agreement comes in, she will handle all the flights, hotels, rental cars, and will communicate with the referent, the facility, and the family.
Yeah, I just want to speak to that for a second. I hear stories all the time from existing past customers of trying to get a client, on the plane, and the client stopped at the bar and the client didn't make the flight. And I've heard even worse stories, like your example from 2008 article. Not that someone's passed away, but that they got to the facility eventually, but were in such a state that actually they now they required acute care. So a hospital, not a detox anymore, because it had, consumed so much alcohol on the journey there. And I don't mean to laugh or be flippant about that at all. It's a really serious thing, getting the client to the facility safely. And so much can go really wrong. Yeah.
Thank you for saying that. We actually had a client, I'll tell you a quick story. We had a client who...
Wait, Marnie, it's a little hard to hear you.
We had a client where, let me talk up a little bit. That was trying to get to the East Coast, and they hadn't called us. The facility was trying to help, just get on the plane. Here's a plane flight, get on. 5 different flights he missed on 5 different days, trying to get through the the airport bar, and couldn't do it. And finally called us, and we're like, oh my God, I just didn't realize what you guys do and how beneficial it is. So I think now we do a lot of transports or safe passages for that facility, but it's just helping those clients get there. A lot of times they aren't emotionally or physically able to get there because of stopping for different things or on their way home. Same.
Yeah, right, in reverse. Mm-hmm.
Yeah.
Very interesting. All right. So any final questions from anyone? This is the time. Otherwise, while we wait and see if there's any final questions, any final words maybe from either of you of maybe, we've given a ton of great knowledge, but for all the behavioral health facilities tuning in, what's the next step? What would be a next step to explore either of these options or to see if they might be a good fit?
Well, for me, can I say they can call me, they can reach out, I can be a resource. Even if you're not using Hired Power or you have a question about our services, always feel free to just call. I think I've been in the industry, like Risa said, for a long time, and I'm willing to, help you find what is appropriate and how we can help you. Maybe you're not sure how we can help you, but I can help guide you on what would be beneficial.
Exactly.
Also, I want to say for Tracy, again, working in the EHR world for a long time, revenue cycle management for me is super important. I think it's super beneficial to your facilities. And I know having in-house, and like one of those questions that said, I have a relationship with somebody. When I worked in EMRs and we sold revenue cycle management similar to what Tracy's doing, and people said, I can't get rid of this person. Well, where else can you find a place for that person in your facility? we're not asking you to get rid of people. We're asking you to do things differently. So Tracy, take it away on that.
Right. Yeah. You know, anybody that's currently maybe doing that billing and collections role, there's a role for them in your company. You know, I need a liaison to talk to on a day-to-day basis. So there's definitely room and a role for that individual. You know, let us do the heavy lifting. Keep that individual in a productive role that supports us. It's a partnership. And, you know, that's what I'm looking for when I'm interviewing a prospect, and also in the existing customers I have now. I really value the partnership, because I'm not perfect and you're not either. None of us are, right? We're working with humans. We're human. We make mistakes. And so as long as you feel comfortable at being able to have a conversation, a dialogue, work through a problem, get it resolved, get it paid.
Got it. Okay, and before we move on to your final remarks, one more question did come in for Tracy. If we're planning to get accredited with any particular organization, is there one you recommend doing first?
I recommend Joint Commission. I know it costs a little bit more money and it probably takes a little bit more time to get, but I do think it has the gravitas and weight of, it carries more weight. It's also critical. A lot of insurance companies, if you're doing inpatient level of care, detox and residential, I think Aetna is one of them, you can't accept the patient until you have Joint Commission or CARF. So there are some that you couldn't even accept that policy because you don't have Joint Commission.
Got it.
So I have a question on that. Can I ask Tracy a question on that?
Yes.
So I have a question. So what you're saying is a lot of times other facilities they'll say I'm in network with ABC. They might not get D because they're not accredited.
No, they wouldn't have gotten that in-network status if they didn't have an accreditation. I'm talking usually in the beginning stages of opening a facility, you have an out-of-network status or profile. You can't take an Aetna patient until you have Joint Commission. Until you have Joint Commission, you can't consider being in network with them either. So kind of all has to fall in, the cards have to fall in line to be able to treat that patient with that particular policy. Yeah.
Interesting. All right. And yes, this session is being recorded and we will send a copy out of this weekend. If you want to pop your email in here, I'll be sure you personally get it, but otherwise we will be sending this to everyone. I don't know when our next follow-up is going to be yet, but I'm happy that you're asking that question. And if that's something everyone is interested in, we can definitely put something together. Okay, thank you. I got your email. So before we move to Tracy's final remarks, thank you, Marnie. It's great. And I wanted to make sure everyone heard that you can use Marnie as a resource, whether or not you're using her, hired powered services. She is a phenomenal resource. I hope everyone knows that. She just knows everything about everything in this industry. And everyone. So thank you so much, Marnie. That's a really great offer. And Tracy also is a phenomenal resource kind of on the opposite end of the money side and making sure your facility is getting paid. So Tracy, what's the next step if someone's interested or, not ready to bite the bullet yet, but just want to start a conversation?
Yeah, I have two business development gentlemen working for me. One's West Coast based, the other is East Coast. We can get them on a call depending on what state you're in and talk about what your challenges are and if we can address them. Be happy to connect with you.
Okay, great. So I just popped in Tracy's contact information into the chat in case anyone missed it. It will obviously be on the follow-up emails as well. But otherwise, I'm really grateful everyone stayed on till the end. Thank you so much. I know there's a lot of information today, but I really hope you guys got a lot of great information about this, about how to use these auxiliary services to help your behavioral health facility get to the next level and continue to be successful. So thank you so much. I hope everyone has a great rest of your day, and we look forward to hearing from you and connecting
Thank you.
offline.
Thank you. Bye, everybody.